Good morning students, I welcome you all for the online class of economics. Today we will be going to complete our chapter, that is infrastructure, so that we can proceed to the environment and sustainable development. Let us complete this chapter properly, that is the infrastructure. The last topic of the infrastructure which is left out is the health, okay, which plays a very vital role in the development of our human development, because a healthy environment will create a healthy economic development of the nation. So human beings health plays a very vital role in the economic progress and development of our nation. Not so, health is also considered in the infrastructure for the hospitals, constructions, medicals, construction that plays a very vital role at timely from place to place, villages, cities and states we can see, but in villages its progress we can see now in the year 2022 as in the earlier time when we will be seeing from the data which is given in the book that shows very less hospitals and medical facilities available in the village area. Because of that, people were moving to the urban areas for the treatments of the various types of ill health. So let us see the health issues which is given in the last part of infrastructure. When we talk about the health, student, it is the holistic process related to the overall growth and development of the nation. As I already said, a healthy human development will make healthy economic development of the nation. So health plays a very vital role. Public health refers to the health status of all the people of the country. It never makes a discrimination between the village and the state. It never makes a discrimination between the rich and the poor. All the people's health and progress will make the progress of the country parallelly. Development of health infrastructure, when we see, ensures a healthy manpower production of goods and services to a country. Health infrastructure includes hospitals, doctors, nurses and other paramedical professionals, beds, equipments required in hospitals and a well-developed pharmaceutical industry. The health infrastructure should be accessible to all the people. The health status of a country can be assessed through indicators like infant mortality and maternal mortality rate. When we talk about infant mortality rate, student, it is that mortality rate which tells us below the age of 1 year how many people means the child who is under the age of 1 is considered as infant, because they are totally dependent on their other. So that child's death rate and birth rate, how much is there, we can know for the infant mortality rate. And maternal mortality rate also stays the same. At the time of childbirth, how many mothers are found dead. So that can be known from the maternal mortality rates. Morbidity, life expectancy and nutritional levels, all this important study related to health and the life of the people can be known from the health status, along with the incidence of communicable and non-communicable diseases. Like now we can see the study which is going that due to this particular pandemic situation of COVID, how many people have been cured, how many people's life has been taken. That all the study tells us about the is known from the health status of the country. Morbidity, when we see, it is defined as a relative incidence of a disease and is shown by the ratio of death in an area to the population of that area. It is known as morbidity. Once again I am repeating, it is that study where we learn relative incidence of a disease and it's shown the ratio of death in the area of the population of that area. Like state wise, now the discussion is done that disease COVID is how much expanded, in which state it has been expanded, in which area it has been controlled, and how many people's death has been done because of this. That is learned through the way of morbidity. It is expressed per thousand per year. It is affected by water supply, sanitation, etc. Now many reasons are there. Bacteria, viruses are the main issues of the morbidity study. The main function of Central Council of Health and Family Welfare is to collect information and render financial and technical assistance to state governments, union territories and other bodies for implementation of important health programs in the country, so that timely action can be taken to stop this type of ill hazards going in the country. The three-tier system of health infrastructure in India means healthcare at primary, secondary and tertiary level. When we go with the primary health care, it includes education concerning prevailing health problems and methods of identifying, preventing and controlling them. Like our government had did, now the primary health action has been taken in which we have got remedies to how to save from this pandemic situation. That is the primary health care. Proper nutrition and adequate supply of water and basic sanitation rules, that is also comes in the primary health care. Maternal and child care. Immunization against major categories of contagious disease. Promotion of mental health. Provision of essential drugs. It includes setting up of primary health center PHCs and community health centers, that is CHC, in villages and small towns. So basic step which is taken by the government to intimate and make awareness among the citizens of the country nationwide. It is known coming in the primary health care. Secondary health care, when comes, it includes hospitals. When the primary health care is not able to manage itself and the situation comes to the hospitals, then it comes in the secondary health care. It includes hospitals which have better health care facilities such as surgery and diagnostics. They are mostly located in district headquarters and big towns. Now, in village areas also many big hospitals has been led by the government so that proper care and health care can be taken of the citizens of the village area, so that proper development and parallel development can be done of city as well as village. Tertiary healthcare, when we comes, it includes all those medical centers and hospitals which give advanced medical care in case of complicated health problems. It also includes many premier institutes which not only impart quality medical education and conduct research but provide specialized medical care. State of health infrastructure in India, when we see student, it covers health infrastructure, effect of good health infrastructure, role of private sector, medical tourism, etc. Let us start with the state of health infrastructure in India. The state health infrastructure of India says that health infrastructure point of India in 2005 was as follows. Number of hospitals and dispensaries were 28,000. Now it has been expanded to lakhs. Number of hospital beds was 9.1 million. Nursing personnel 8.7 lakh. Now more it has been done till 2022. Allopathic doctors 5.2 lakhs in the year 2005. Effects of good health infrastructure, when we see, the result of good health infrastructure has been eradication of smallpox, decline in death rate to 8 per thousand in 2001, reduction in infant mortality rate to 7 per thousand in 2001. It means it has been controlled. Result in rise in life expectancy to 64 years in 2001. Control of diseases like cholera, smallpox, malaria, tuberculosis, polio and leprosy has been done. Now even the jaundice, yellow fever also has been controlled in many of the areas, which was due to the poor water supply. Fall in child mortality rate to 23 per thousand in 2001. Child mortality rate is defined as death of children up to 4 years of age. Infant is less than 1 year, but child mortality rate is up to 4 years of age child. Role of private sector, when we see in recent times, private sector has been playing a dominant role in medical education and training, medical technology and diagnostics, manufacture and sale of pharmaceuticals, hospitals construction and the provision of medical services. In 2001 and 2002, there were more than 13 lakh medical enterprises employing 22 lakh peoples. Medical tourism point, when we see, since the 1990s, owing to liberalization measures, many non-resident Indians and industrial and pharmaceutical companies have set up state-of-the-art super specialty hospitals to attract rich medical tourists. Medical tourists come to India to avail of our health services, which contribute latest medical technologies with qualified professionals and are cheaper for foreigners as compared to cost of similar healthcare services in their own countries. They come for surgeries, liver transplants, dental and cosmetic care. Even in our locality from foreign, many doctors are called up, appointments are made, so that instead of going to foreign country, now the foreign doctors can come and make a proper check and surgeries in our own country, so that cost will become less. Next is role of community and non-profit organizations. When we go to the role of community and non-profit organizations, the basic idea behind this organization is to train people and involve them in primary health care system. Some examples of NGOs are working in India to build alternate healthcare services for their members and to give low cost care to people from nearby villages. So now the NGO's duty is to go door to door, see that how much is the percentage of people taking vaccinations, going to hospitals for treatment and helping those who are not done. So that now the India will be getting proper development in the health area also. This is the work done by the NGOs. Seva in Ahmedabad is one of the NGO, Accord in Nilgiris. Kastakari Sangathan is a rural organization where women health workers are trained to treat simple illness at low cost. Even nowadays, maternity care also, for that nurses and doctors are appointed from village to village, so that proper treatment of mothers can be taken at the time of birth of the child and before the birth of the child. They will get their name registered, so that properly care can be taken by going to their home, or if they possible they can come to the hospitals and can get free treatments at the hospitals. Indian system of medicines, when we talk ISM, the 6 system of Indian medicines are Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy. Most properly people goes to the allopathy there. Homeopathy is also considered as Ayush. At present there are 33,855 hospitals and dispensaries. There are 6,11,431 registered practitioners in India. But the framework of education or research is still inadequate. Economic Survey 2009 and 10. Some premier institutes which give specialized medical care in India are All India Institute of Medical Science AIIMS, New Delhi, Postgraduate Institute, Chandigarh, Jawaharlal Nehru Institute of Postgraduate Medical Education and Research, Puducherry, National Institute of Mental Health and Neuroscience, Bangalore, and All India Institute of Hygiene and Public Health, Kolkata. So these are the various big health centers where the steps are taken to take care of the peoples of different regions. Emerging challenges in the health infrastructure when we see students. The following points will highlight the need to have strong health infrastructure. Very first, high GBD. What is GBD? Global burden of diseases. It is an indicator used by experts to gauge the number of people dying prematurely due to particular disease, as well as number of years spent by them in a state of disability owing to the disease. Like nowadays the pandemic is going, the work is of the particular doctors is to measure why the death rate is increasing, and if it is getting cured, the reasons for the same. So all this is done by the global burden of disease, which is an indicator used by the experts to know the number of people dying prematurely. Now like heart diseases are increasing, not only in the old age but also in the young age. So what is the causes? How it can be stopped? That is the way how they can be treated. India bears a frightening 20% of the global burden of diseases. In India, more than half of global burden of diseases is accounted for by communicable disease such as diarrhea, malaria, tuberculosis, now the COVID. Every year around 5 lakh children die of waterborne diseases like jaundice and many other. The danger of AIDS is also looming large. Malnutrition and inadequate supply of vaccines lead to the death of 2.2 million children every year. Now also it is still existing. Poor state of primary health centers, when we see at present less than 20% of the population utilizes public health facilities. Only 30% of the primary health centers have the required numbers of doctors. Only 30% of the physical primary health centers have sufficient stock of medicines. Regional bias, urban-rural divide, when we see students, only 1/5 of total hospitals are located in rural areas. Out of about 7 lakh beds, roughly 11% are available in rural areas. Now we have seen practically when the situation of our country, even many medical health facilities was taken from outside country. Many had donated in the poor situations. So the health point, when we see our health are still stagnating with many of the facility which is needed by the health departments for taking care of the people. There are only about 0.36 hospitals for every 1 lakh people in rural areas, while urban areas have 3.6 hospitals for the same number of peoples. Primary health centers located in rural areas do not offer even X-ray or blood testing facility. Because of that, people of rural areas have to come with their terrible diseases to urban areas so as to get this particular test in this worst situation. Next comes state like Bihar, Madhya Pradesh, Rajasthan and Uttar Pradesh are relatively lagging behind in healthcare facilities. Now it has been updated in this 10 years time. Villages have no access to any specialized medical care like pediatrics, gynecology, anesthesia and obstetrics. Even though 165 recognized medical colleges produce 12,000 medical graduates every year, the shortage of doctors in rural areas persists. Because of that, in this 10 years period of time, it has been increased. Medical colleges number increased, medical seats number has been increased so that more and more students can help in the health issues. While 1/5 of these doctors leave the country for better monetary prospect and many other opt for private hospitals which are mostly located in urban areas. And we have even seen in our this pandemic 3-year situations when doctors have only for their upgradations and in the salary and many other things they had make a strike and they are not supported in the particular pandemic situations. They had made the work of the hospitals worst in this particular situation. Income bias, poor-rich divide. The poorest 20% of Indians spend 12% of their income on healthcare, while the rich spend only 2%. Many poor people have to sell their land or even pledge their children to afford medical treatments. The poor are driven to private hospitals, which makes them indebted forever. Even worse situations are there for many of the families. Gender bias situation, when we see about the health, poor health of women. Now also it is practically seen in many houses. There is growing incidence of female foeticide in the country. Close to 3 lakh girls under the age of 15 are not only married but have already born children at least once. Now there is a different scenario we can see there. More than 50% of married women between the age group of 15 and 49 years suffer from anemia caused by iron deficiency. It has contributed to 19% of maternal deaths. Measurement to cope up with these challenges facing the health sector, what we have learnt in these points, we can see health is a vital public good and basic human right. All citizens can get better health facilities if public health services are decentralized. Some measure must be taken surely that our success in the long-term battle against diseases depends on education and efficient health infrastructure. It is therefore critical to create awareness on health and hygiene system. But now if we will see practically these 3 years pandemic situation which arise, government had first make awareness among the people themselves so that they will take proper care at their home themselves. So that secondary health centers issue will not be there. But still the situation was created. People after getting the awareness and being educated had not understand the situation of worst. The role of telecom and IT sectors cannot be neglected in this process. The effectiveness of healthcare programs also rest on primary centers. Effort should be made to make primary health centers more efficient, and that has been done. Encouragement should be given to private-public partnership. They can effectively ensure reliability, quality and affordability of both drugs and medical care. So in a sense, if we see, both private and public sector unitely must see the importance of health sector and have to parallelly work. Instead of seeing their own profit and objective, they must think about the health of all, because a healthy environment, a healthy people will be a healthy citizen of the country, which can make a healthy economic development of the nation. So this was the infrastructure, students, which we have learned. The last was the health, which is very important. In this we have learned the past 2009 and 10 current issues are there related to this, like COVID situation can be asked the questions, infrastructure, how much development has been made in this vital situation, worst situation of our country, that can be known from this infrastructure topics. So this was our topic, infrastructure. I hope you have understood. Next class we will be going to start our next topic of the chapter, that is environment and sustainable development. Till the time, have a nice day. We prepared the notes of each and every ID topic so that it will be easier for us to revise and recall each and every step what we have learned chapter wise. Thank you for today's class. Have a nice day.